Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Good afternoon and welcome to the POMA Does podcast. I'm your host today, Tyler Burke, the Senior Director of Government Affairs, and I want to talk about the budget. The budget passed on July 12th, a resoundingly quick turnaround compared to last year. So let's talk about what was contained. $50.8 billion is the magic number. That got us across the finish line, got the legislators home, and able to start campaigning for November. In POMA's mind, to our patients who we care about, our membership, the budget was largely uncontroversial. There is $678 million in additional education funding, expanded support for career and tech education, funding for 4 additional state police cadet classes, new investments in Pennsylvania's healthcare and behavioral health workforce, $10 million in dedicated state funds for 988 crisis hotline, and $5 million for mental health walk-in crisis centers. So as you can see, not really anything that we have been advocating for or against was included in that budget, which is a good thing and a bad thing. So what do we have to look forward to? Right now, they're back in their district campaigning. If you have time, go meet with your legislator, go attend a community event, go talk to them, go educate them about what the osteopathic profession is and how you help your community and why you want to be an educational resource to them. But beyond that, we're already starting to catch wind of what's going to be coming down the pike in September, October, and when they return after the November election. So as you can imagine, scope of practice has been almost on the back burner for the past session. And so there are groups who are chomping at the bit to get scope of practice expansion moving. Just today, Dr. Bill Kaprevich testified on POMA's behalf with legislation for physical therapists to expand direct access and dry needling. That hearing was vital because this is how legislators collect information on bills that they want to change and amend as we go through the process. Especially when we talk scope of practice is much more a stakeholder process, hopefully, usually when it is undertaken. And so POMA having a seat at the table remains to be one of the most important things that POMA does. And how do we get that seat at the table? By keeping your voices elevated and making sure that we know your elected officials and having you know your elected officials. And so that brings me to the ultimate piece here. POMA is creating our first ever Advocacy Day on October 6th. That is going to be a Tuesday in October, and we're going to hopefully bring a bunch of osteopathic advocates to Harrisburg to advocate on behalf of the profession and our patients. We're going to talk about scope of practice, education, reimbursement, and what an osteopathic physician is, because not a lot of people understand what a DO actually does. And so making sure that we have that understanding built in before scope of practice is on the table is going to be vital. So I really task you with attending if you are interested in advocacy in any way. Look for the official announcement in Under the Dome coming out this next month. Thank you, and keep listening to POMA Does for more information about the osteopathic profession in Pennsylvania.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.